I'm Jerry Ferrillo, the owner of Family Caregivers Network, and it is Friday, June 26th. Do you know what day today is? It is Green Day. Today was a day that we went green in Montgomery, Bucks, Berks, Lehigh counties, and pretty much the rest of Pennsylvania, except for one county. That was Lancaster County. They remain in the yellow phase. So, I wanted to talk to you today about actually 10 items are on my list. So, bear with me. It's a pretty inclusive list, but I wanted to go over a few things. I know it's been a couple of weeks since you heard from me via video, and I wanted to just take this time since we are loosening up restrictions in Pennsylvania, particularly our geographic area, and going green. I wanted to make sure that everybody really understood what it means and how important it is because you're an essential worker as to taking care of business with our clients. So let's get started. So the green phase means that now the governor has opened businesses 50% capacity pretty much for a business to be able to allow individuals into their business. So salons, gyms, retail, malls have opened, daycares have opened, things such as that. Social gatherings cannot exceed 250 people. So you might think, wow, that is great. That's a large amount that can gather. Sure, it is for somebody that maybe wants to have a wedding or something, but you still need to social distance. You still need to put practices in place so that you can't transmit the virus. Because guess what, guys? The virus is here. It hasn't gone anywhere. It's here. So you may feel like it's changed. You may be tired of all of this, but the bottom line is it's still here, and it's going to be here until there is a vaccine for all of us. So it's our new norm. We have to be patient. We have to be diligent. And we have to continue to protect each other, and particularly our elderly seniors that we take care of. So I just wanted to go through a few reminders as to what is that going to look like for you guys. So you all know you're an essential worker, right? Family Caregivers is an essential business. And as a healthcare worker, there's certain responsibilities that come with the jobs that we take on. And one of them being, as part of the restrictions and the guidelines, is we must wear masks. Must. It is not optional. We must wear masks. You have to wear masks when you're with a patient. You need to wear a mask when you're out doing various errands and things. You need to wear a mask when you're off duty and you're out in the public doing things. You need to wear a mask if you go to the mall. You need to wear a mask if you are vacationing somewhere. You need to take those masks with you. We have plenty of them now in our office. We got a large quantity. Thank you to Jeff Stauffer at Stauffer Glove and Safety. They were able to secure us a case of regular surgical masks. We're still a little low on the N95 masks, but we have them so that if we have a COVID patient, we're able to properly take care of them. Your cloth masks, we still have plenty here at our office that were made by a wonderful woman up in northern Pennsylvania. And if anyone needs any additional masks such as that, or even a surgical mask, you just let us know and you can have them. Usually every Friday, and today is payday Friday, you will see that the supplies are in the mailbox. So let's talk about infection control practices, because that's this is really all about. Wearing a mask is our first defense, right? It's like your skin. When they say, what is your first defense for fighting infections? It's our skin, right? We need to hand wash, okay? And you hand wash for 20 seconds. You know the drill, singing happy birthday. Sing it slowly or sing it twice, making sure that you get all aspects of your hands. Same thing when you use hand sanitizer. You need to use a good amount. Make sure you get it all over your hands. So the second form of prevention or our defense is wearing of those masks. In addition to, you need to be able to use gloves. Gloves when you're caring for your patient, doing any type of hands-on care. If you're doing any wiping down within the home, those sorts of things. You need to make sure you are properly dressed with the PPE. I sent a few weeks ago the video regarding how to properly put on PPE and how to take it off. For those of you who are new to our organization, if it's something that you have not watched or have not seen, let me know and we will make sure that you have it, because there is a proper way of actually putting on the equipment that's necessary to protect you and also protect our seniors that we're taking care of. I want to talk a little bit about when you are in a home. Please make sure screening continues of the patients. You need to be checking their temperatures, checking for infections, asking them how they're feeling. All that needs to be recorded. I check those reports every day to see how a person is doing. And if I see a variable, something that's not good, we need to follow up on it, because we need to make sure that the patient is either seeing the doctor that needs to be followed up on, or the family is notified of it. But the screening of those patients is really important. In addition to the screening of you yourself, every day you need to get up, you need to take your temperature, you need to report if you've had any type of respiratory illness, any GI illness, anything like that. And you know that logging in now into our software system, you have to answer those questions. And if something looks like it's out of whack, not right, we're going to be able to stop you from going to work, so we can maybe send you for testing if necessary, send you home, do a follow-up, or maybe you need to quarantine for 14 days. Okay, all that is still going on like it was back in March, early April. Okay, so it still is going on. You need to make sure you're doing that. If you don't have a thermometer, let us know. If a patient doesn't have a thermometer, please let us know, because we have them at the office and we can make sure that everyone has one. Okay, any questions about it, you can reach out to me or Jennifer, and we'll give you more information on it. In addition to, at the home, make sure that you have the clean and dirty area of the home identified when you walk in. If you're not sure, you need to look around. You need to ask the patient, where's the trash kept? That's going to be the dirty area of the home. That's where you're going to throw away your PPE when you're taking it off in the home. If you're wearing your mask and you leave the patient's home, you're going to re-sanitize your hands, take their mask off because you're going to get into the car. You need to make sure that you have a proper place where you're going to keep that mask in your car till you get to the next patient. So make sure you're identifying those clean and dirty areas of the home. Also make sure that when you enter the home, first, well, let's back up. You're getting out of your car. What's the first thing you're going to do? I wish I could see hands go up, but I can't. Okay, the first thing you're going to do is use that hand sanitizer, right? Because the next thing you're going to do is you're going to put your mask on, because you're going to have your mask on before you enter the patient's home. And once you're in the patient's home, you're going to log in, correct? Or maybe you logged in outside, okay, in their porch or just outside their home. That's okay too. The first thing you're going to do when you're back in their home, you're going to go and wash your hands. And you may say, why do I need to do that? Because I just did that when I got out of my car before I put my mask on. Well, you've touched a few things, haven't you? If they're in a high rise, you might have pressed a few buttons, okay? You might have touched a few doorknobs. You need to wash your hands. Then you can begin to take care of the patient. It's really important for you to wipe down the areas, sanitize the areas where you're going to be doing in the home. I know some of our visits are for housekeeping and that sort of thing, which is great what we're doing. But for those that we're not, if we're just there for giving them a bath, you need to make sure that you're wiping that area down before you go forward with providing the care for them. If anybody has any questions about this, just let us know. Now let's talk about the data. The data here in our geographic area continues to be a little flatline, but it is going up. We are in the Upper Perkiomen Valley, and recently in this past week, our numbers have increased in East Greenville, Pennsburg, and Red Hill. So Upper Hanover has remained at 20, pretty steady in that area. East Greenville has jumped up to 14. It was at 8. So you may say, well, that's not too many, but you think about how many people that outreaches to other individuals that person comes in contact with. In Pennsburg, we are up from 7 to now 13 individuals that have been diagnosed with COVID. In Red Hill, it has gone from 5 up to 8. So that's a significant amount in our small geographic area that we have seen increase. So it is really important, not only here in the Upper Perkiomen Valley, but all over, that you are being diligent and continue to take this seriously by wearing your masks. Keep your goggles, your gloves, all your essential protective equipment with you at all times, okay? And follow the protocols that you've been instructed on. As far as when you're off duty, you need to continue to also be diligent in taking care of following those infection control practices. You need to make sure you're wearing a mask, as I said. If you are going on vacation and you are out and about in large crowds, you're very concerned when you come back, you can go get tested. Everyone can get tested. It is free. There are testing sites all over the county. Each of the counties, they have them. I'm going to send you a paper from the county commissioners, which will have more information about where the testing is. But all you have to do is sign up. You don't even need to call us, though I would like to know if you're going to go get tested. Call and let us know. It takes anywhere from 24 to 72 hours to get those testing results back. But all you have to do is go online, sign up, get your appointment, and go and get tested. You're a healthcare worker, let them know that. Answer the questions. You may not have any symptoms, but you are a healthcare worker. Maybe you've been around a lot of people. You feel that you might be exposed. Go and get tested. The other testing they're starting to do now is the antibody testing. They are doing that down in Warrington at a place called Passport Health, and anyone can get tested for the antibodies. Okay, so take a look at that. We are actually looking to see whether or not we can get them to come to family caregivers and actually do massive testing of a lot of our employees. They say on their website that they will do that for businesses. So stay posted. I'll let you know more about that information if we're able to do it. If in the meantime you think that maybe you had some symptoms, or maybe you think you want to go and get tested and just see if you have antibodies in your system, you can do that. Once again, it's called Passport Health, and it's down in Warrington, Pennsylvania. One of the last things I want to mention to you is the bonus program that we have with new hires. You maybe have seen our signs up there. We are offering a $500 sign-on bonus for new hires. Okay, so no, you can't quit and then decide to come back and sign on and get the $500. But what you can do as a current employee is we have an employee referral bonus program. So give a call over to the office. If you know somebody that you want to refer to work at Family Caregivers, just let Jennifer or Cheryl know. They'll talk to you about the bonus structure for you. But pass the word along, especially with our bonus structure, why it's so important for us to get more people on staff with us. We are in a critical crunch at this point with the lack of employees. You know how much overtime you're working. You know how often we're calling and asking you to do the work. So if you know somebody out there, pass the word along so that we can get some more employees on staff with us. We're hoping that maybe by the end of summer, when some individuals have decided that they're ready to go back to work, we're going to see that influx. But for now, it's at a critical point, so please help us out there. And that's it for me at this point. I want to say thank you, thank you, thank you for all you're doing for our patients, taking care of them. You are my true heroes, and I thank you from the bottom of my heart. Have a great weekend, and I'll talk to you next week. Bye-bye.